Tonight, a New Jersey mom wants you to pay attention to a new CDC warning. It's about a virus that's hitting kids, and it landed her little boy in the hospital. And Jenny, it has symptoms that kind of mimic polio.
Well, it can, Jason. It can lead to muscle weakness. And for this family in particular, difficulty breathing was the major symptom. This is Kelly O'Neill and her 3-year-old son, Owen, happy and excited the night before the first day of preschool. But hours later, her son's health took a turn.
You could tell he was just desperate for relief of whatever pain he was in.
What Kelly thought was a mild cold with some sniffles and cough turned into labored breathing with a respiratory rate of 40 breaths per minute.
When he reached 40, that's when I said, we need to go to the emergency room.
Kelly says her son was admitted to the hospital and placed on oxygen. He tested positive for both rhinovirus and enterovirus. On Friday, the CDC put out a warning of increased hospitalizations amongst children coming down with these two viruses. In some cases, they can cause polio-like muscle weakness.
Trouble swallowing, droopy face, anything like that with muscle weakness, you need to get attention medically right away.
Dr. Mike Sirigliano says late summer, early fall is the season for these viruses.
What we are seeing, though, now is an uptick in numbers in a number of communities in the United States.
Kelly says thankfully her son was released from the hospital a couple of days later.
It was awful. It was really, really scary.
Kelly put out a warning to other parents on social media, which actually prompted a friend to take her son to the ER. Angela Sealski commented that her son remains in the pediatric ICU with similar viruses, but his condition is improving drastically.
Their immune systems aren't as strong as they were. These kids were locked up for 2 years and their immune systems aren't great. I don't want to scare people, but I do think that parents need to keep an extra eye on their kids.
And Kelly says counting her son's breaths was critical. That's how she knew that there was a problem, and they decided to rush her son to the hospital. Back to you.
Knowledge is important here. All parents kind of paying attention to this one. All right, Jenny, thank you very much.